I will get us started. The meeting is being recorded, so if that is not something that you want to be a part of, please feel free to exit now and we'll share the materials on our meetings and materials page. But good afternoon. My name is Kristen Steimanoff and I'm the Washington Wellness Program Manager, and I'm so glad you've joined us for our first Wellness Coordinator training of 2023. As most of you hopefully already know, our Washington Wellness Program works to promote key wellness benefits that are available to employees and their eligible dependents, their eligible spouses and state registered domestic partners who are on their plans. These wellness benefits include SmartHealth, diabetes prevention programs, and tobacco cessation programs. And they're available to employees at state agencies, school organizations, higher education institutions, and public employers that get their employee benefits through the PEBB or SEBB programs. Next slide, Sarah. Another really important function of our program is to help employers, and that means all of you, to build, grow, and sustain effective employee wellness programs. We have an excellent team that's dedicated to supporting you. So before we dive into today's training, I want to make sure that you know who we are and who to reach out to if you need help. I already introduced myself. I'm Kristen Steimanoff, and I'm the program manager. And working with me here at the Healthcare Authority are 3 health promotion consultants who support specific employer groups. So Erin Huff supports state agencies. Heidi Helsley supports schools participating in the SEBB program. And Mandy LeBlanc currently supports public employer groups and higher education institutions. Our longtime colleague, Pam Walker, has retired, and we're working hard to fill that position, so we'll have a staffing update for you very soon. And our colleagues at Limeade, the SmartHealth vendor, the brains behind the program, are also very much a part of our team. Heather Barrick is a customer success manager at Limeade, and in her role, she really focuses on improving overall well-being and driving employee engagement and ensuring an excellent employee experience. Sarah Bell is a senior employee experience specialist at Limeade, and Sarah has been embedded with our team since the SEBB program began in 2020. And Jamie Wise is the newest member of our extended team. She began as an employee experience specialist at Limeade in October and has been with us since then. Not everyone I just introduced has a presenting role today, but all are integral to the work that we do with you and for you. So I wanted to make sure you had a chance to learn about us. But now that you know the team, I'm going to turn things over to Mandy LeBlanc, who is our team training lead, and she will set the stage for what you're going to be learning today.
Thank you, Kristen. My name is Mandy LeBlanc, and I just want to welcome you to this training and let you know what to expect. First, we'll go through welcome and introductions, then into the overview of the SmartHealth themes. We'll cover what's new in the Wellness Coordinator channel, very exciting. Then Sarah will take us through the Insights Dashboard training. We'll have a little bit of time for questions and wrap up and a post survey, so please stay tuned. The learning objectives for today are to understand why and how to download then utilize the SmartHealth Dashboard reports for your organization as one key part of ongoing improvement for your wellness program. So we hope that by the time you complete this, you'll learn how to download your own reports and be able to use them as you plan your wellness program for this year and years to come. Thank you. And I'll toss it over to Heather from Limeade.
Hello, everybody. So real quick, as we dive into the data, we thought it'd be a great idea to bring to focus the themes that we're going to be utilizing for SmartHealth in 2023. And Sarah, if you can go to the next slide for me. Thank you. So as previously sent out and mentioned to everyone, these are our quarterly themes: my well-being, work well-being, family well-being, and social well-being. You can also see when new activities will be launching. And then within each quarter, we know that there's not just one theme that's going to cover every nuance and every observance, and with so much going on and such a diverse population. So therefore, we also have focuses. So the focus in January, or quarter one, I should say, but really in January has been know your benefits. So these are a lot of those health plan activities that you should be seeing in your SmartHealth platform, along with some additional call to actions that you're going to see through our new communications features on how to utilize those benefits and why you might want to. We're also going to be focusing on connection and community. As we move into quarter two, we'll be looking at belonging and inclusion and preventative care. So diving a little bit more into the why behind what this is looking at. So within that quarterly focus of my well-being, as you can see in these first cycle of activities that are coming out, cycle 1 and cycle 2, we have a good number of your health plan activities that are going to be launching, but then we also wanted to focus on you. We wanted to focus on your well-being. As the common phrase in travel goes, you have to put your own oxygen mask on first before you can help others. So therefore, we're kicking off the year focusing on you, your well-being, your sleep, your energy, your positivity, making sure that you have a solid foundation for your well-being before you launch into creating wellness programs for everyone else that you're working with, along with your own family, your own colleagues, and your own friends. So very exciting for this year is the Wellness Coordinator channel, which we have previously mentioned as well. If you'll go to the next slide for me, Sarah. So as a reminder, you can find this on SmartHealth by going to your Services tab, pictured here on the desktop, and then you'll see the folder Wellness Coordinator Resources. That's where you will also find documents from today's training, along with the housing that it currently goes to with on HCA website. So again, when you're opening that, you'll see resources, you'll see the folders, and we've decided to give as easy access as we can. So those folders, I know it's small print, but if you go to SmartHealth right now, you'll see this live. You can see benefits, promotions, best practices for worksite wellness, and additional folders and resources. We will continue to add and build these resources throughout the year. Many of you had great feedback into what should be included. We can encourage you to continue that feedback. Let your health promotion consultant know. And if you have materials that you feel are beneficial, not just to you, but to others, please share. We would love to get that in the hands of all of your colleagues. And next slide, Sarah. Thank you. All right, so as we kick over for Insight Dashboard training, and so as we talk about training, and Sarah, if you want to go and go to the next slide, and then I will turn it over to you in just a second. As we talk about training, it's very important that as we go through the data. Data is such a very useful tool. It tells a very positive story, but I would encourage all of you, as I'm about to turn this over to Sarah, as she's walking you through, is to remember that there's a human component to all of our data. And within health and wellness, it can be super simple to very much look at the black and white, to look at participation numbers and to look at trends and trending data. But we often forget that there's a human at the center of that has to make the decision towards a healthy habit or towards a wellness goal or a well-being journey. So as you're going to hear some really great insight from Sarah, I encourage you to have that mindset as well. And then we'll be happy to answer questions towards the end. So Sarah, I will turn it over to you.
Thank you, Heather. That was a good point that you just left off at. So hello, everybody. I'm happy to be here today to guide you through the dashboard. Today, we're going to make sure to highlight some key areas that will provide value to your programs. So first off, let's start with why the data is important and how you can use it to enhance your well-being programs. So measure program goals. Having access to this dashboard will give you the data to show growth and changes in SmartHealth registration, well-being assessment completion, participation, and monthly active users. This can provide you with the numbers that you need to help measure your program goals. Know your employees. Today, I'm going to show you how to view the activities your employees are participating in. So from this, you will have insight into what your employees enjoy, maybe what they're working on, and you can gather info on what well-being areas your employees are interested in. Also included in the dashboard, but not in today's training, is where you can see the aggregate data on the well-being assessment. Every organization has access to an annual report where you can see a breakdown of the well-being assessment and how your employees scored. Program guidance. So having all of this quantitative data can help guide your wellness program. It can lead you to what resources and events you should provide your employees because you know what they will want and need. This is also a little plug to promote custom activities and communications within the SmartHealth platform, so you can help tailor SmartHealth even more to your organization and your needs. Leadership support. We know that successful well-being programs and healthier employees need leadership support. So access to this dashboard can provide you with the data you need to prove value in your asks. So whether that's leadership participation, budget requests, or event or resource approvals, data can be key in helping to build your case. And lastly, being empowered. We oftentimes have programs that we believe is providing value and we believe we are offering resources that our employees want and need. But having the hard data to back this up is important, and you can feel sure that you are providing programs that truly offer value to your specific employees. Okay, so let's take a look inside the Insights dashboard. So here's the login page. It's insights.limeade.com. If you do not have access and you are someone in your organization that identifies with being responsible for your wellness program, you can reach out to your health promotion consultant and request access. One thing to note here is there's a little forgot your password at the bottom. So if you ever forget your password, there's an easy option right there. Okay, so when you log in, you will hit a home page. Where you want to go is down to that little Explore tab. A good thing that you can do is hit a little star to favorite the page. It's just easier so you don't have to go through all of these steps every single time. So where you're going to want to land is go to hit Explore and then go to Limeade Insights. For future reference, when you're going to find your annual report, you're going to go to SmartHealth Legacy Dashboards. You all will have access to several different dashboards, but the main one you're going to use and the one that we're focusing on today is the program summary. So when you go to program summary, you are already targeted to your specific organization. So for the purpose of today, we've kind of covered up some of the controls that identify our example. But when you land on this page, where you want to go first is over on the top left-hand corner of the control section is program year. So make sure you hit the program year you want to look at. Member type, if you go down a couple blocks, the member type, you have access to either seeing all employees, SmartHealth eligible employees, or portal access only. So portal access only would be your spouses. You then also have access to toggle on to include terminations. So any employees that were with you at some point in the year and then no longer are working at your organization. So it defaults to exclude those people, but if you wanted to see just the whole year and everybody that participated, you can always click all. And then don't worry about that next PEBB or SEBB. That one actually won't do anything for you for the purposes of you guys. Okay, so let's zoom in. I just zoomed in. If you remember the last page, I zoomed in on the program summary just because it's kind of small. So these numbers I think are the most important. You can see right here how many users are registered and how many are eligible. So in this example, you can see that 66% of the organization's employees are registered for SmartHealth. Moving over to the right, you can see how many have completed the well-being assessment, how many participated in activities. The monthly active user metric is how many users, how many employees have participated in SmartHealth within the last 30 days. So this is always a moving number. So if you look at this today or you look at this tomorrow, this number could change. And then last is the user satisfaction rating. So when you're in SmartHealth, There's a great little pop-up survey with stars, and it asks users to rate their experience, and they also have the option to comment. So this is, in this example, 4.3 out of 5 is a pretty good rating. Let's see. Also to point out is this user group comparison. You can use this to slice and dice data of both your registered employees and also your total eligible employees. So some of the demographics that you might want to look at is age and gender. You can also look at health plan breakdown if that's of interest to you. And if you have any questions about the codes that you see, you can reach out to your health promotion consultant. And then we have these trend lines. I think what's great, it's a snapshot over time. And what's great to see is just change. So if we're looking over at, how many people have completed this assessment or participated in activities, you can see this nice little trend line over time of, slowly going up. Oftentimes people might have like an event or a big communication push. And it's just interesting to see, I did a big SmartHealth promotion, like, did I see a bump in registration or did I see a bump in participation? And that can be useful just as you are planning out your promotions, communications, and events. Okay, and then as we move down the page, so this is just kind of on like the bottom part of that program summary, we see incentive levels. So the current view you see is what incentive level your employees are currently at. So employees only show up in one level. If you toggle down for this distribution and you go down to cumulative, it shows a different view and you can see employees of every level they've completed. So in theory, an employee can show up in all 3 levels if they've gone through all 3 levels. And as a reminder, level 1 is completing the well-being assessment. Level 2 is earning their incentive, which means completing their assessment and then also in total earning 2,000 points. And level 3, we call them our super users. They've gone above and beyond. They're no longer receiving any extrinsic rewards, but they are, having fun participating in the program. On the right is activity participation. So this is a list of SmartHealth activities. And you can use this to see what activities your employees are participating in and notice any trends, like which ones are popular. And for another view of activity participation, I'll show you the activity detail tab on the next slide. But first, as we continue down this section, right here, I don't even know if you can see my arrow or not, but program summary dashboard user guide is there for you if you have any questions about the dashboard. A nice little guide pops up. And then also something important to note is that if either your organization has less than 20 people or if less than 20 employees are participating, these numbers everywhere within this dashboard will show up as blank. So that's for privacy purposes. Okay, so if you look up at these tabs, we were in program summary. If you tab over, there's activity detail. So where you want to look at is, again, go to the control section first. You want to make sure that you're in the proper year that you would like to view. As you continue down, also make sure you have the proper controls of the employees that you would like to be viewing. And this is just like a nicer way to look at the activity detail versus on the program summary. It kind of gave a little snapshot. This kind of is an expanded view. You're able to see how many people have joined, number who have earned points, percentages, and the point value for those activities. And if you hover over the activity name, you can see the full name as well. And I always also would like to tell wellness coordinators, if they have any questions like, hey, I noticed I had a high number of participants in this activity. What was this activity? You know, like it just gives the title. Just reach out to your health promotion consultant and we can all work together to give you like the full detail of that activity. So that actually concludes our really quick look inside the Insights Dashboard. And I also, a little plug is to stay tuned for your Wellbeing Assessment Annual Report that's going to be available soon. And that is another great place to find some really useful data. And I'll pass it back to Mandy.
Thank you. We can now open it up to questions. We're going to put a post survey in the chat. It's already in there for some of you. I'm going to repost it now. You can either ask questions by unmuting if you want to, or you can put the question in the chat. Thank you.
It looks like there was maybe one question that came in so far. And the question was, how do I get employer access to SmartHealth to see the resources?
Excellent question. So I can take that one. So both for the Wellness Coordinator resource, so the Wellness Coordinator channel on SmartHealth, as well as the Insights Dashboard, you just want to reach out to your health promotion consultant and let them know that you would like access.
Hi, this is Brandy from the Health District. So I'm the one who asked that question, and I haven't been able to contact anyone, or I don't know who to reach out to. So I guess I'm just looking for more information. Would that be something you guys could help with?
Absolutely.
Yep.
Go ahead, Mandy.
I'm sorry, could you say where you work again?
The Yakima Health District.
All right, that might be me. So I can give you I'll put my email address in the chat.
Perfect.
Great. And I see there's a question on the how do I get access to Limeade? Did we cover that?
Yeah, so how do you get access to Limeade? So if you are, and Sarah and Kristen, keep me honest, if we are SmartHealth eligible, then you should receive an invite. You can go into Limeade and register for your account. If you're having any access issues after you've done so, please reach out, and I'll drop this in the chat as well, to support@limeade.com, and they will help you out.
So Heather, I wonder, let's try to get a little clarification about this question, because there's SmartHealth, which all employees who get their benefits through PEBB or SEBB can have access to, and SmartHealth is powered by Limeade. So I think that's what you were speaking to, Heather. But then there's also the Insights Dashboard, which only the folks on this call basically have access to. So I want to make sure I understand what they're asking. How do you get access to Limeade? What, Christine, can you say specifically what you're looking for?
The Insights Dashboard.
Insights Dashboard, okay.
Yeah, I tried all the user IDs I could think of, and I don't think I have access to that.
Got it. Okay. So, sorry, Heather, this is one thing that I never help people with, because all of our pro health promotion consultants and Sarah and Jamie do. Can you repeat the instruction for Christine?
Yes.
Or, yeah.
Yes. So first, and I see Pam, you've also put in there too, reach out to your health promotion consultant and let them know that you need access, or if you believe you've had previous access but maybe just can't get back in, let them know that as well. And then they'll work through Sarah and Jamie, and we will make sure we get you up and running.
And remember, the health promotion consultants are Erin Huff, if you work for a state agency, Heidi Helsley, if you work for a school organization, or Mandy LeBlanc, if you work for a public employer or a higher ed institution, until we have our new person in, which hopefully will be within the next few weeks. I'm also gonna put into the chat our general email address so that you can get to us that way too.
And I see
And
that
Heidi also dropped in. Yep.
Go for it.
Heidi also dropped in the contact us, so you can find all of the
perfect
consultant contacts. I was going to tag you because I feel like you always have that like ready to go with every training of just drop it in. So she was there, she knew. And a few others I'm seeing coming in. So yes, if you are having trouble with the dashboard or if you need access, please work directly with your health promotion consultant rather than directly with Limeade. And the reason why that is because A, it ensures that we are all on the same page. We're getting you the specific access that you need. As you can imagine, with so many organizations, we want to make sure that we have it right the first time and that we have your access correct. And so this just ensures, if you're working with Aaron, that he's well aware of what's going on and what you need. So please work directly with your health promotion consultant on that.
I want to jump up to make sure we covered when will the 2022 WBA report be available? Have we covered that question yet?
We have not covered that question yet. Sarah, I don't know if you want to add anything else other than more details are coming soon. I know it's a cliffhanger and a teaser, but that is what I have right now for you.
Okay, are there other questions?
I think I'll also just give another plug on my plugs is, this was a quick snapshot training. If anyone feels like it would be great to walk through it for their specific organization, happy to, reach out to your health promotion consultant, and all of us can do that together. And, I know I work closely with Heidi with school employees, happy to, do a more tailored, specific one-on-one training with any of you if you're interested in that.
The next question that I see is, how do we get the resources folder to our dashboard, our SmartHealth dashboard?
Yep, so I want to make sure that we're clear on those two places. And Sarah, if you could back up in the slide deck to the Wellness Coordinator resource. Thank you. So there are two areas that we're talking about. So the Wellness Coordinator folder or resources are on your SmartHealth. So you log in as you would to earn your incentive, to complete activities, etc. And on that services tab, if you'll go one back for me, Sarah, you're going to see a folder that says Wellness Coordinator resources. Yes, that is only visible if you are a coordinator and you've been granted access by your health promotion consultant. You will see that there. So that's in your normal SmartHealth. Your Insights dashboard, where the data that we were just sharing views of lives, is outside of the platform. So it's a separate website, and that's for security purposes. And that's at insights.limeade.com. So there's two areas we're talking about, both of which you can have access to by going through your health promotion consultant.
And it looks like Kristen already answered Kimberly Cook's question of, if employees have difficulty logging into Limeade with their SAW account, who do we refer them to? And Kristen has admitted that you can send an email to support@limeade.com for challenges logging in with Limeade.
I want to give a little bit of a caveat to that, though, because the challenges have been kind of on various fronts. Sometimes folks don't understand exactly what they have to do. And so I also put a link to a document that Heidi on our team worked very hard on that gives the whole nitty-gritty overview of how to get into SmartHealth now that we go in through Secure Access Washington. Every once in a while, it's not really that frequent, but every once in a while, people have problems with SAW itself. And if the issue is with Secure Access Washington, you have to go through SAW support. Limeade isn't going to be able to help you with that. We're not going to be able to help you with that. But if you refer to that Accessing SmartHealth guide, it'll tell you everything you should need to know. And then if the challenge is getting into SAW, you'll have to go through Secure Access Washington support. If you can get into SAW, fine, but you can't get into SmartHealth from there, support@limeade.com. Or if Heather or Jamie or Sarah could enter the 800 number into the chat. I always forget it. I should just like write it on a sticky note by my desktop, but sometimes that's a little bit faster than the email. Thanks, Brandy. I'm glad you found it helpful. I really appreciate it. I know we do this every year. I don't know if others of you have joined us in the past, but I love the slides that Limeade prepared this time because they're a wonderful resource that you can keep and refer back to. And I'm hoping those will be helpful too.
If you don't have other questions, if you wouldn't mind completing the survey, I can put that back in at the dashboard on the chat again.
Thanks, Gary. Gary is suggesting a simple chart that shows the 3 resources: accessing SmartHealth Wellness Coordinator channel, and now the dashboard. Thank you for that input. That is a really good opportunity for us to put our brains to. Lots and lots of excellent resources. We want to make sure you know what they are and how to get to them. Do fill out the evaluation if you haven't had a chance. It'll really help us know where to focus next. Heather just put the form in the chat. It's super short. But if there are any other questions, we'll definitely stick around until we're done getting questions, or 1 o'clock, whichever comes first. Thank you, Heather. Limeade support. So if you have employees or yourselves having a hard time getting into SmartHealth and it's not a SAW specific question, then try the 800 number for Limeade. Joseph, welcome. We are hoping to have a recording link available if the higher powers that be. Oh, he's sorry. Joseph is messaging me wondering if there will be a recording link. We are trying to record it. So hopefully that'll work and we'll send it to you. There is another session today at 4 if anybody wants to come back and hear it again. It's a different link, right, Mandy? I think
That's correct. Different registration that would have come from an email from your health services consultant. You look up in your email through the Insight training that we would have sent out.
Yeah, Joseph, if you still have that message, if anyone wants to join at 4, if you got a message from Erin or from Heidi or from Mandy inviting you to the trainings, there was one link for the noon session and a different link for the 4 o'clock session, and you can register through that.
I see Gary's asked a question about, will this link for this session be in the Wellness Coordinator channel? So we'll be saving this recording, and we'll also be saving the presentation and putting those in on our website that we'll send out afterwards, as well as the Wellness Coordinator channel once it's ready. Should we make a last call for questions?
Last call for questions. I'm glad that we had, it's always good to have questions. Always glad when people want to know more. Oh, thank you, Heidi. This is the link to register for the 4 o'clock session. All right, I say we give it 1 more minute. And if we don't see anything else, we'll see anyone who wants to join us at 4 o'clock, or we'll see you on the Wellness Coordinator channel. Thank you, everybody. Thanks, Gary. Thanks, Christine. We really, really appreciate having you all join us and learn about what we're trying to offer. All right, Mandy, I think we can call it.
All right. Thank you, everybody. Take care.
Thank you.